So the term doctor comes from the same root as doctrine, means teacher. And so I think it's the highest role that physicians have is to teach their patients how to be healthy. And as a teacher, one of my greatest joys is to be explaining something and have the light go on in the listener's eyes where I can see they're thinking, oh, is that how that works? And I have hopefully loaded this presentation with lots of those moments. So at the end, you'll say, oh, so that's how a plant-based diet actually can go about reversing these diseases. And so join me on this journey. I hope you enjoy it. For the past 4.5 years now, I've been going to the nation's medical schools, and I've been lecturing to the first, second, third-year medical students, the interns, the residents, the young attending physicians. I want to reach them with a message about the importance of their patient's diet in the diseases these young doctors are going to be spending their time treating. And I tell them in medical school, we learn how to diagnose and treat all sorts of weird and wonderful diseases from smallpox to leprosy. But when you get out in the real world, in your own practice, and you open the door in the waiting room, and it doesn't matter what specialty you go into, what clinic you're in, if you go into family practice, internal medicine, emergency medicine, but even gastroenterology, endocrinology, orthopedics, anesthesia, pediatrics. When you open the door in the waiting room and you look at the patients who are there waiting to see you to relieve their suffering, who do you see? You see a large group of people with a small group of chronic diseases. Most of them clinically are going to be either overweight or clinically obese statistically. You're going to see clogged arteries in all sorts of manifestations from high lipids, high blood pressure, and obstructive conditions like angina and claudication. You're going to see rampant type 2 diabetes and a host of inflammatory diseases affecting every organ system from lungs to gut to joints to immune system. This is Western medicine in the 21st century. And you open the door and you see the patients waiting to get your wise counsel. And the reality, if you had to describe them, most of them have some, not all of them, of course, but most Americans and Canadians and Brits and Australians and New Zealanders these days, anyone eating the Western diet is generally has some element. They're overweight, diabetic, hypertensive, high blood pressure, atherosclerotic, and inflamed. This is the overlay or the background, if you will, of which medicine is practiced. And what's the job? Every young med student says, your job is to diagnose these people, put a label on the diseases they have so we know what we're dealing with, and then come up with some kind of treatment plan. And it usually means some medication or referral to some surgical specialist. And at that point, the primary care doc has done their job, and off the patient goes for drugs or surgery. That mindset is what I call pharmacosclerosis set into these young doctors' brains here, where they think drugs and surgery are the only treatment for diseases. And if you ask the professors or looking online or in the medical textbooks for the cause of these diseases, you run into two words that generally stop all further thought. Etiology unknown. We don't know the cause of high blood pressure. We don't know the cause of type 2 diabetes. And yes, I will grant that there's much to learn about these conditions, and we have not teased out every last interaction between every gene and every enzyme. And blessings on those erstwhile scientists in those labs trying to understand the disease model on this molecular level. But to think that these erstwhile scientists are going to come up with a make and getting down to the real cause and the real treatment for these conditions. So I tell the students, this is not a lecture with lots of graphs and figures in it. This is a report from the front lines of a scout who's been at the coalface, if you will, for the last 5 decades. And now I'm shouting back to the reinforcements that are coming online, the new young doctors, and to share with them the knowledge that I had and to share with you the knowledge I have now that I couldn't have known when I started medical practice. I wish someone had told me that these diseases are reversible. And if you understand the mechanism behind it, you'll understand you have the key to the most exciting transformation in health and medical care to date, where you can truly restore patients to glowing health by changing their diet to a truly health promoting one. And this is the pinnacle of medicine. And I want to talk to you about how physicians can help their patients achieve this kind of improvement. Because for the first 10 years of my medical career, I spent it chasing numbers. I was an erstwhile young GP, and much to my dismay, despite my counseling and my most fervent efforts, I watched on the patient's chart a steady upward progression of numbers. Their body weights climbed steadily. Their blood pressures went up, their blood sugars went up, their inflammatory markers went up. And along with that, my dosages of insulin and prednisone, anti-inflammatories, beta blockers, they also went up. And I got really despondent because despite my best effort and these potent medications, I was getting calls in the emergency room on a daily basis, it would seem, but certainly frequently, that Dr. Klaper, your patient Joe Smith, is in the ER here with chest pain. He's having a heart attack, myocardial infarction. The Mary Jones is in, and she's had a big old stroke. She can't move the left side of her body. And I felt like a complete failure when it came to helping my patients. And I came to understand why so many medical colleagues are leaving the profession. And they're despondent. My patient, they tell me, they're all getting fatter and sicker. They're all getting strokes and heart attacks. And that's a dismal way to practice medicine. So no wonder so many primary care physicians are leaving the profession. Well, midway in my career, I had the privilege and honor of joining the attending medical staff at True North Health Center in Santa Rosa, California, about an hour north of San Francisco. And at True North, we had the same river of American patients coming in with the classic panoply of chronic diseases. They were overweight, hypertensive, clogged up, and inflamed, like most Americans. But at True North, instead of putting these people on a regimen of increasing medications, we put them on a diet based on whole plant foods. And every morning at breakfast, we had a big container of fresh oatmeal, steel cut oats with lots of fresh fruit and sunflower seeds and almonds to put on it with a nice plant milk, oat milk, soy milk, etc. And every lunch, every dinner had big colorful salads, hearty vegetable soups, big plates of steamed green and yellow vegetables, and a host of really satisfying, filling whole plant food entrees from stews and soups and curries and no cheese burritos and no oil stir fries. Just a gourmand's delight, and lots of fresh, colorful, tasty food for dessert. And we encourage them to eat all they want. There's no portion control. There's no calorie counting, no carb counting. Eat till your stomach is full, because, again, these foods are mostly fiber and water. And if you go back for a third bowl of vegetable soup, who cares? It really has no adverse effect. The fiber goes out in the stool, the water goes out in the urine, and it leaves people leaner, healthier, and feeling great. So this was the magic ingredient that created these wonderful improvements at True North, and we would see them predictably. I have to laugh when I was on TV. I see the weight loss commercials. These people lose all this weight, and the little fine print at the bottom says, "This is not typical results." Well, the transformation you're seeing in this man on the right there, these are typical results. This is what we see with this kind of dietary program. The obesity begins to melt away promptly. They lose about 2 pounds a day for the first few weeks and about a pound a day after that. Their arteries begin to relax and dilate. This lowers their blood pressure. We're able to lower the blood pressure medications they're on. Inflammation throughout the body begins to reduce. This is an anti-inflammatory diet. And their joints stop hurting. Their sinus infections get better. Their migraine headaches improve. With all the the fiber in the fruits and the vegetables and the whole grains and the beans, peas, chickpeas, lentils, all these wonderful resistant starches. These folks have their first good bowel movement in years, and that improves their outlook on the entire universe. The folks who come in with eczema and psoriasis, we see these remarkable clearings of the skin lesions right before our eyes. The dermatologists struggle for weeks and months to get improvements in psoriasis. We see them promptly on this kind of skin regimen, this kind of diet regimen. The asthmatic folks find their lungs are not so wheezy. They use their albuterol inhalers much less and often stop using them altogether. They get a good night's sleep for the first time in a long time. And it allows us, the improvements in these conditions, to reduce the medications, reduce or stop the insulin, the hypoglycemic agents, the blood pressure medications, the anti-inflammatories. We want to send these patients out free of medications. And what we're trying to accomplish is this remarkable concept that no one even mentioned to me in medical school, and they're still not mentioning it. But we're talking about disease reversal. I wish in medical school someone told me that most high blood pressure is a reversible disease. I wish someone had told me that type 2 diabetes is reversible. We get, and most medical students today get the opposite message. High blood pressure, they will take these pills the rest of their life. No one gets off blood pressure medication. Insulin, diabetes, one's on insulin, always on insulin. That's the dogma that we were given. And this is what the young students and young doctors bring into their medical practice, these ideas that these are chronic, irreversible diseases, when actually the opposite is true. We see these diseases go away on a regular basis. So with uh, the concept of disease reversal, the the oh no, oh boy, did I just do that? Okay, sorry about that. The concept of reversal, what is that? I practiced medicine for decades before anybody put those two words in the same sentence for me. We're talking about remission of clinical symptoms. Their joints stop hurting, their lungs stop wheezing, their skin clears up clinically, their body is healthier. But also we see normalization of their laboratory results, and their inflammatory markers come down, their lipid values normalize. And this is the definition of disease reversal when we're talking about this. And it's the most exciting concept in medicine today, disease reversal through plant-based nutrition. And I tell the young doctors, this should be your goal and it should be your patient's goal. You need to tell the patient, how'd you like to get rid of your high blood pressure? How'd you like to get rid of your type 2 diabetes? And help them achieve this goal because it is achievable. And as I became a student of the benefits of whole food plant-based nutrition upon chronic disease, I began to see journal articles appearing in the medical journals on a regular basis showing the power of a plant-based diet to relieve the 9 most common diseases that most doctors spend most of their careers treating: clogged arteries, type 2 diabetes, obesity, high blood pressure, autoimmune inflammatory diseases like lupus, inflammatory bowel disease like colitis and Crohn's disease, inflammatory arthritis, asthma, and psoriasis. These conditions regularly, dramatically improve on a diet based on whole plant foods. And today it's hard to open a medical journal without seeing some article on the benefits of plant-based nutrition upon one or more of these conditions. So the question is, why does it work? How does it work? Show me the science. That's what this talk is about. You are interested enough to be watching this presentation. So I think as a teacher, physician, physician-teacher, we owe you an explanation. Here is how it works. And so you can believe that it is worthwhile pursuing a whole food plant-based dietary style. Now, to understand how and why the plant-based diet creates these beneficial changes, an automotive analogy might help. let's say you're driving your car, you see the gas gauge points down to almost empty. So you pull into the gas station, and as you pull in, you see that the diesel fuel is 6 cents a gallon cheaper than the gasoline. So you decide from now on, I'm going to save money. I'm going to fill my gas tank up 2/3 with gasoline, petrol, and 1/3 with diesel fuel. Well, diesel fuel is kerosene, basically. It's oily. It does not burn cleanly. And as a result, you put diesel fuel into a gasoline burning engine, and the results are predictable. The spark plugs are going to cake up with carbon deposits. The exhaust manifold will obstruct. The catalytic converter is going to be ruined. And the person who sees the black smoke coming out from their engine will reach the logical conclusion, then my car's developed a disease. No, the car has not developed a disease. That engine is malfunctioning precisely, predictable, clear. You can read newsprint through normal serum. This is what your blood should look like after you eat a meal. But you eat a standard Western meal, you have those bacon and eggs for breakfast and the cheeseburger for lunch or the chicken for dinner or the dairy during the day. And if an hour after one of these meals, I sneak up on you and draw that same 5 cc's of blood into the tube and spin it down, what we would see is blood that looks like this. This cloudy material up on in the serum here, this is called lipemia. It means fat in the blood. Lipoemia means fat in the blood. Postprandial means after eating. So this is the fat in the blood that shows up after one eats. It's mostly triglycerides and saturated fats from the fats in the food the person just ate, along with the cholesterol from the animal muscle that the patient ate. Now, I will grant that not everybody shows the fat this optically densely, but everybody has a wave of fat that goes through the bloodstream after you eat such a meal. How can you not? Where else is it going to go? Of course. And your blood stays this kind of fatty for a good count them, 5 hours after such a meal. Here's a cool classic study. They gave someone a fatty meal at hour 0, and they drew blood once an hour for 6 hours. And they took those 6 blood tubes and put them one after another into an instrument that measures how fatty the blood is getting. And you can see the blood getting fattier and fattier and fattier and fattier. It takes the liver a good 5 hours before it begins to clear the fat out of the blood. And and during this time, when the blood is running thick with fat, evil things are happening in the body. Certainly bad cholesterol is increasing, but so is the blood viscosity. The red cells start sticking together. The blood becomes thicker and more dense, and it doesn't deliver oxygen and nutrients as well. And it's harder to force thick blood through tiny capillary beds, so blood pressure goes up. The fat flows through the abdominal fat stores, increasing obesity. That increases the risk for inflammation and type 2 diabetes. We'll talk about that in a minute. This increases insulin resistance, so blood sugar goes up. And the saturated fats are pro-inflammatory. It raises inflammatory reactions throughout the body. This is the result of a standard Western meal, as I showed you. Now, I've been focusing on the fat because it's the most visibly obvious, to show you how long the effects of a given meal last in the body. But there's more than fat in that blood, and it is a high salt diet. When you think about what most Americans eat, most Westerners eat, there's salt in the meat, salt in the cheese, salt in the French fries, salt in the potato chips, salt on the sausages. It's a high sodium diet. And we are well aware that the sodium can penetrate into the walls of the arteries, stiffening them and making the kidneys retain water to dilute out the sodium, and the increased fluid in the bloodstream and the stiff artery walls creates high blood pressure. That opens the door to heart attacks, strokes, congestive heart failure, but also we are learning that high salt diets increase the activity of Th17 helper cells, and that opens the door to autoimmune diseases like lupus. So who knew that high salt diets invite lupus and autoimmune diseases into the body, but they do. And as a recovering saltaholic myself, I'm looking for ways to entertain my tongue with non-salty flavorings. And I'm able to do that with lemon juice and balsamic vinegars and these various salt substitutes. So whatever you can do to lower the salt content in your diet is probably a wise thing for many reasons. So the high salt diet is an issue that we have to deal with, but so is the sugar in the diet. Now, everybody likes sugar, and I'm not talking about a little half teaspoon of sugar in your tea. I'm talking about eating sugar as a food. When you eat a vegan cupcake or cookies or a chocolate bar or drink a cola drink, you are flooding your tissues with grams and grams of glucose, fructose, dextrose, maltose, and these sugars stick to proteins all over the body. They become glycosylated. And glycosylated proteins are stiff, they don't work as well. But very importantly, when you then heat these glycosylated proteins, you produce what's called advanced glycation end products, or AGEs. Don't worry about the name so much. Remember the acronym. AGEs age you. They are teeming with free radicals. These are atoms that have lost an electron, and they will rip electrons off any passing molecule, including your DNA, your cell membranes. You don't want to eat things with lots of AGEs in it, but that's what gets produced when you drop potato chips into boiling oil. You create lots of AGEs. When you bake those cookies, you create what's called the Maillard reaction, and that is the heating of these glycosylated proteins. And that's what produces the crust on breads. And you don't need a whole lot of that. But this is the Maillard reaction. You can create it with your own body heat, just eating the sugars and glycosylating your own protein, your own body heat will run a low-grade version of the Maillard reaction that the bakers use to make baked bread. Your own body heat will create that, and you create these AGEs from just eating the sugars. That's why you don't want to eat sugar as a food. It's a flavoring. And it's one thing to create these AGEs on the surface of a French baguette or on a chocolate chip cookie. But boy, you don't want to run the Maillard reaction and the crystalline proteins in the lens of your eye. It's a great way to open the door to cataracts. You don't want to run the Maillard reaction on the elastin fibers in your skin. It's a great way to to turn your skin into an old suitcase. And you sure don't want to run the Maillard reaction on the inner lining of the blood vessels of your brain. This is the membranes across which oxygen has to be delivered. And the effects of putting all these AGEs into the brain arteries are dramatic. Here are the arteries of two men. These are the brain arteries, the middle cerebral arteries, of two men who died at the same age. But the man in the upper panel here did not have Alzheimer's dementia. The man down in the lower panel did have Alzheimer's dementia. And you can see how the man with the Alzheimer's has arteries that are thickened and edematous. And if you stain for the AGEs, you'll see these artery walls are filled with these advanced glycation end products. There's a big vascular component to Alzheimer's disease. Now, this dementia is not something that falls out of a tree on you at age 70. This is 65 years of running the meat, the dairy, oil, sugars, the Western diet through our vascular system. The arteries suffer for it, and eventually so does our brain. Turns out, by the way, we'll get to it, but cooking carbohydrates is actually not the main source of AGEs in the diet. It's cooking animal muscle. This, by far, is the major source of advanced glycation end products in the Western diet. We'll come back to that in a minute. So you shouldn't be eating either the cooked carbohydrates or the cooked animal muscle. They're both filled with these AGEs. And the free radicals they contain are molecular terrorists that will rip electrons off your DNA. So this first part of the talk has been trying to alert you that vegan junk foods, the salty snacks, the sugary snacks, the preformed AGEs in the high temperature cooking, the vegetable oils, these are all pro-inflammatory, damaging molecules. That's why we emphasize whole food, plant-based instead of the word vegan. I'm very favorably disposed to the idea of a vegan diet, but in today's world, that a vegan diet allows all these junk foods, as I'm trying to tell you. Now, these foods can really hurt you. So go for whole food, plant-based nutrition, and you'll stay away from this dangerous swamp of snack foods that really age our tissues. Now that I've made this obligatory stop in vegan junk food land, let's talk about the reality of what most Westerners eat. It's not a vegan diet. There's a piece of animal muscle in the center of essentially every meal that most Westerners eat. And if that piece of animal muscle is missing, you call the weight person over and say, "Hey, where's my protein?" We really think that meat is the sole source of protein in the Western diet. Well, not only is that not true, as we'll talk about in a minute, but look at the reality of what a meal based with a piece of muscle in the center of it sends through every cell in your body for hours after every meat-based meal. First of all, no one eats raw meat. The very act of cooking the meat, of grilling the burger, broiling the steak, frying the chicken, oxidizes the cholesterol in the animal muscle, which I'll show you in a minute. And oxidized cholesterol particles are the main drivers of atherosclerotic plaque formation in the artery walls. So a surge of oxidized cholesterol molecules pours through the tissues with every animal-based meal, and that those oxidized cholesterol molecules work their way into the artery walls. When you broil the steak or grill the burger, you're going to be oxidizing the nucleic acids and the glycogen in the animal muscle. That generates what are called reactive aldehydes like glyoxyl and acrolein. These are mutagenic. That means they damage your genes. They damage your DNA. These are the same genes that call forth the enzymes in your cells that let your tissues do their biochemistry. Why eat a lunch that damages your very DNA? But that's what a diet, what a meal based on cooked animal muscle guarantees. New 5-GC, this is a sialic acid that only animals make, and it drives inflammatory reactions throughout the body. And our paleo friends and our keto friends are giving themselves a shot of New 5-GC 2-3 times a day with every meat-based meal. And then there's endotoxin. All of us who've gone through medical school learn about endotoxin. And when you spend time in the intensive care unit, you see people dying of endotoxic shock. It is nasty stuff. What is it and where does it come from? It comes from the slaughterhouse. All animals, including organic grass-fed beef and free-range chickens, they all pass through the slaughterhouse. And as the carcass is eviscerated, as the digestive system is removed, you inevitably get spillage of the gut contents. You can take a culture tube and swab any cutting surface in the meat packing plant, and you'll get a luxurious growth of E. coli and Salmonella and Shigella bacteria, Enterococcus, Clostridia, Pseudomonas, the whole rogues gallery of enteric bacteria are covering every steak and chop and chicken breast and turkey cutlet that leaves the slaughterhouse as a film of these bacteria on the surface of them. And the meat is wrapped in clear plastic and sent to your supermarket, where under the ultraviolet light in the meat case, these bacteria die. But as these microbes die, their cell walls break up, and it breaks up and releases this nasty lipopolysaccharide called endotoxin. This is nasty stuff. Take a little walk around this daisy of death to see what endotoxin does. It generates more free radical, depresses heart function, releases histamine, makes your blood clot. Nasty stuff, endotoxin. And it's heat stable. Grilling the burger, broiling the steak does not get rid of the endotoxin. And guess what? Endotoxin makes your gut leaky. It increases intestinal permeability, and that allows food proteins and bacterial cell walls to leak into the immune system, into the bloodstream, and set off inflammatory reactions throughout the body. Nasty stuff, endotoxin. And again, our paleo friends are giving themselves a shot of it 3 times a day. And it turns out that the absorption of endotoxin is increased by fat in the diet. Well, guess what? The standard meat-based diet had lots of fat in it. That's what makes that chicken finger licking good. They raise these animals to be as fatty as possible. So the fat that's in the meat increases the absorption of the endotoxin that increases all the bad effects of it. TMAO, what is that? Trimethylamine oxide. Well, the food you eat determines the microbes that live in your gut, and the microbes that are summoned up by a diet based on meat and eggs are going to make these molecules generate what's called trimethylene oxide. This drives cholesterol into the artery walls, increasing the risk of heart attacks and strokes. And the keto folks and the paleo folks are walking around with high levels of TMAO. Broiling the steak and grilling the burger inevitably creates cancer-causing molecules that smear on the stomach wall, giving gastric cancers, smears on the colon wall, giving colon cancers. When you eat meat and all those amino acids flood into the liver responds by putting out a surge of insulin like growth factor 1. This is one of those powerful growth promoting hormones in the body. And it's great if you're a growing boy or girl, but if you're an adult woman with an early breast cancer, or you're a guy with a big prostate and some malignant cells deep inside of it, the last thing you want is a diet that makes you walk around with high levels of IGF-1, but that's exactly what a diet based on animal flesh creates. And if you are a dairy fan, that mother cow wants to give her growing baby calf lots of IGF-1. So dairy products and milk has lots of IGF-1 in it. And again, not so healthy if you are an adult person trying to avoid cancer growth. Heme iron makes red meat red. It also increases the risk of strokes and cancers. Don't have time to go into the mechanism of it. And the animals in the feedlot are fed bushels of grains that are sprayed with pesticides and herbicides. They drink water with mercury, cadmium, lead in it, and they're given hormones and antibiotics as growth promoters. All of these toxic molecules accumulate in the animal's flesh. And when you bite into that chicken breast or into that burger, you're eating all the bioconcentrated pesticides and herbicides and heavy metals and hormones and antibiotics that animal was fed during its life. And as I mentioned, just grilling the burger or broiling the steak, frying the chicken creates these advanced glycation end products that create oxidative damage throughout the body. This is what surges through every cell in your body, every tissue, every organ in your body with every meat-based meal. And it lasts for hours. It's what I call the postprandial red tide. Postprandial, again, it's after eating. And these are just some of the constituents, the molecular marauders that make up the red tide. It's a fatty tide, it's a salty tide, it's a sugary tide. It's antigenic, sets off immune reactions. It's full of phosphates and sulfates that form acids in the blood that need to be neutralized by kidneys and bones, not to their advantage. It's mutagenic, damages your genes. It's carcinogenic, sets off cancers. It's atherogenic, leads to artery clogging. It's pro-inflammatory, and it disrupts enzyme reactions throughout the body. This is what the red tide does to us. And again, Americans eating the standard meat-based diet are sending a surge of the red tide through their tissues 3 times a day, or sometimes 4 times a day, hour after hour. And if you do the math, if you eat 3 times a day for every year, 365 days, that's over 1,000 times a year you are surging the red tide through your tissues. And we've learned in physiology that within minutes of eating anything, molecules of that food are flowing through every cell in your body, where your DNA molecules lie unfolded, exposing your genes. And the food molecules flow over your DNA molecules and they play your DNA like a piano. And these food molecules turn genes on, they turn genes off. They induce enzymes, they shut enzymes down. Every meal brings in not only nutrients, it brings in information. Every meal changes us on a genetic molecular level. And you don't need to be a geneticist to understand that the genes that are going to be turned on by this broiled steak, full of endotoxin and new 5GC and reactive aldehydes and the AGs, all of that fleet of molecular marauders drive the genes that we know promote aging and inflammation, autoimmune disease, and cancer growth. Those genes that are being turned on by this piece of broiled animal muscle are a totally different set of genes than are going to be turned on by this green salad that bathes the tissues with all these plant-based nutrients that are antioxidants. They quench free radicals. They promote tissue repair. They promote membrane stabilization. They give the molecular message to your tissues, shh, calm down, everything's okay. And the difference between an animal-based meal and a plant-based meal is, in computer analogies, the difference between one and zero. It's that profound a difference. And in one sentence, your genes may load the gun. You may have a genetic propensity towards a given disease in your family, but whether that disease actually manifests in your body or your patient's body largely, not completely, but largely depends upon the food you're flowing through those tissues every few hours. The turning of genes on and off by external forces is called epigenetics, and it is such a powerful force, way beyond anything that most doctors were taught in medical school. Here you see an example of how powerful the epigenetic effect is. Um, on the left-hand panel, this is the genetic readout of the prostate tissue of a man with early-stage prostate cancer. And these are the genes in the prostate cancer tissue. And all these red patches here, these are active oncogenes. These are genes that promote the growth of cancer. And you can see how many of these cancer-promoting genes are turned on in this man's prostate gland. He then went on a diet based of whole plant foods. And day after day, he ran those salads and soups and steamed veggies through his prostate gland. 4 months later, they did another biopsy. Same man, same prostate gland, same genes. They did the analysis, and look how many of these red, angry oncogenes have now, quote, turned green, have been silenced. They are no longer driving the cancer growth based on the patient's diet. Now, as a lifestyle medicine physician, I'll say absolutely there are other factors, enough sleep, enough exercise, loving relationships. Yes, all those other lifestyle pillars are important. But the food that one is flowing through their tissues on a regular basis by far is the most powerful determinant of whether that body is going to be healthy or ridden with disease. Food is such a powerful driving force of health or disease. It changes us in one of two ways, either directly, as I mentioned, epigenetically, the way new 5GC turns on inflammation, but also the food we eat changes the microbes that live in our gut, and they will change us by the byproducts that they produce, that everything from neurotransmitters to factors that change the absorption, the membrane permeability in our intestine. Food is such a powerful shaper of our overall physiology. And so I tell the young doctors, when you're in clinic and you open the door of the exam room and there you see your patients waiting for you, and the man with the clogged arteries with his angina, the lady with asthma puffing on her albuterol inhaler, the man with type 2 diabetes injecting insulin, the woman grieving over her acne-scarred face. The professors and the textbooks will say, oh, etiology unknown. We don't know the effects. But I'm saying, really, In this day and age, can we ignore the effects of what that patient is flowing through their tissues every 4 hours, year after year after year? And the only equation I will give you in this talk is that the food effects over time create the health effects. Yes, there are other factors, but it is by far the most powerful driving force of either health or disease. And so, as I said earlier, these 9 conditions are the major ones that occupy most doctors' primary care time, and all of them have been shown to improve or resolve completely on a diet based on whole plant foods. The whole food plant-based diet is what we're talking about here. So the question is, as the promise on this presentation is made, how does it do it? Why does it work? Why does a plant-based diet reverse the disease? So here is the tofu of the lecture here. Let's talk about why and how it actually reverses disease. So here we are, our patient or our student is still back eating the standard Western diet, still eating the burgers and the pizzas and the fried chicken. And comes that fateful day. They're getting out of the shower and they look in the mirror, they catch a glimpse of their body and they don't like what they see. They like their big distended obese abdomen. They don't like their swollen sore joints, their broken out skin, the medicine cabinet full of pills. And the light goes on, the voice in their head starts screaming, I can't keep doing this. I got to change something. I cannot go on in this kind of body. Something bad is going to happen. And they soon wind up in their doctor's office, say, Doctor, please help me. I've got to change my diet. I've got to change my health situation. What can I do? And the doctor, who hopefully is aware of the factors that I'm relating in this presentation, says, well, by far, the first thing you should do, the most important thing you can do is change your diet. Stop the meat, the dairy, the oils, the processed foods, and go to one based on whole plant foods, like I showed you on the True North slide there. And the patient who is so motivated says, I got it, doc. I'm in, boots in, as they say in New Zealand. I'm fully committed. When the patient does that, they go home, they clean out their fridge, get rid of all the junk food in there, and start eating the salads and soups and steamed veggies, etc. Look at what happens. First and foremost, here is the battalion of red tide marauders. As soon as they stop the burgers and the pizzas and the chicken, etc., the most, and by far the most beneficial, powerful factor is that the red tide stops. There is respite. Every tissue in your body knows how to heal itself. Every cell in your body has built-in repair mechanisms to repair damaged structures, membranes, DNA. Do you know that you have on your strands of DNA, there are globular proteins wrapped around them that spend all day going up and down your DNA strands looking for damaged genes on your DNA. They are called DNA editing enzymes. And they go up and down your DNA. When they find a mismatch or a damaged gene, they repair it. They know just how to do it. They don't have to ask your permission. They repair your DNA. What a brilliant mechanism. But your repair mechanisms cannot function optimally if every 4 hours you are flooding them with oxidized cholesterol and cooked animal muscle and AGEs and free radicals from the vegetable oils, that you're foiling your own repair mechanisms. As soon as you go and do a diet which is whole food, plant-based, look at the changes. Instead of the red tide marauders flushing through every cell of your body with every meal, here is what now flushes through your tissues with every meal. First of all, it's a high water content diet. All the fruits and the vegetables and the soups and the salads, they're full of water. And so your blood contains more water. It's more watery blood. It's less viscous. It flows more easily through capillary beds. The blood viscosity goes down. That's going to increase delivery of oxygen and nutrients throughout the body. And fortunately, that works very well with the fact that all the dark green vegetables you're now eating increases the production of nitric oxide in the artery walls, and that produces a very subtle dilation of the artery walls, and the slightly wider pipes, if you will lower the pressure in the pipes in the artery system. So lower blood pressure means we can lower medications to lower blood pressure. But very importantly, this very subtle dilation of the arteries calls into play now a law from physics called Poiseuille's law. And that law tells us that even just a small increase in the diameter of the blood vessel means a big increase in the flow of blood through that blood vessel. The blood flow will increase by the fourth power of the increase of the radius, is what the law says. So if the artery increases by a factor of 2, the blood flow increases by a factor of 2 times 2 times 2 times 2 by a factor of 16. And that makes a tremendous difference, delivering a surge of oxygen and nutrients to vascular beds, capillary beds throughout the body. When you pull out the animal flesh, you are pulling out most of the arachidonic acid. This is the major fat that drives inflammation throughout the body. And so you pull that out as you get rid of the animal products. And now all the fats in the diet are coming from plant oils. Many of them are omega-3 in nature, and they are anti-inflammatory. So you've gone from a pro-inflammatory fat mixture to an anti-inflammatory mixture. You've changed the inflammatory balance of tissues throughout the body. And as all these lovely salads and soups and steamed veggies are consumed, every meal brings a surge of antioxidant molecules. That's what's making the colorful vegetables have their wonderful vivid colors. Now, these are molecules that quench free radicals, that find these molecular terrorists that are ripping electrons off your DNA, etc. And the antioxidant molecules say, here, hey, free radical, you want an electron? Here, take some of mine. I've got free electrons to spare, and it quenches the free radicals. And that will lower the oxidative stress in tissues throughout the body. So you've changed the oxidative milieu of tissues throughout the body. This is absolutely huge. When you change the food flowing through the gut, you're going to change the microbes that live in that gut. If you were eating the standard Western diet full of meat, you're going to foster the production of lots of bacteria that are not so friendly, the Bacteroidetes phyla that put out pro-inflammatory byproducts that make the gut leaky, that drive inflammation in the gut wall. Well, you pull out the meat and the dairy, and now all the nutrients coming down are high fiber ones filled with the resistant starches and the beneficial fibers that make it all the way to the colon, that promotes the growth of beneficial microbes like Prevotella. And their byproducts are more anti-inflammatory, and they heal the gut wall. And also these microbes, their byproducts are molecules like dopamine and norepinephrine and serotonin. These are feel-good molecules that get into our tissues, that work their way into the brain. People often notice that, hey, since I've gone plant-based, I feel generally more positive and generally happier. That's not a placebo effect. That is a gift from the microbiome that has now become far more benevolent. When you stop eating other animals' cholesterol, your own lipids are going to be improved and far less likely to cause atherosclerotic plaque formation. I'll show you that in a minute. The fats in our diet work their way out to our skin oils. And a diet based on animal flesh often creates a body odor like the Green Bay Packer locker room at halftime. And many people, guys especially, notice, hey, ever since I went plant-based, my wife says I don't smell anymore and I don't stink anymore. And that's, again, not a placebo. That's another gift from the plant-based oils in the diet. When you stop consuming dairy products, you lower the amount of estrogens that you're ingesting. The cows in the dairy have been genetically modified. So they'll give give milk all through their pregnancy. They're pregnant cows now, and their milk is full of estrogens, like all female animals milk would be, and IGF-1, etc. Well, you pull out the dairy. And the hormone-laden other meats and animal products, and your own levels of estrogens that drive everything from breast lumps to prostate cancer, those decrease over time. Uh, your kidney function gets better. High protein diets are not friendly to the kidneys. When all those amino acids in meat slam into the filter membranes of the kidneys, they drive the kidneys into a state of what's called hyperfiltration. And it's a stressful state that is maintained month after month, causes damage to the kidneys, opening the door to kidney failure, chronic kidney disease, CKD. The asthmatic folks notice their lung mucus gets thinner, and so they wheeze less. The white blood cell count starts dropping, but people don't get more infections. It's because the owner of the bone marrow, where the white cells are made, stop preying in that bone marrow with endotoxin 3 times a day. So white blood cell counts normally go down. At least twice a year, I get a call from some family doctor panic that their patient's white cell count is dropping. And should they send them to a hematologist? No, you shouldn't, doctor. That's what's supposed to happen. And people are supposed to walk around with blood counts, white counts of 3,000, 2,800. That's not disease. We've just accepted the normal increase rate because of the diet most patients are eating. So these are just some of the changes that happen when one goes from an animal-based diet to a plant-based diet. And if someone asked me, Dr. Klaper, tell me what changes when one leaves the standard Western meat-based diet and goes to a diet based on whole plant foods, what changes? In a word, everything changes. It's a different biochemical body. The very tissue fluids, the very cell milieux inside the cell, outside the cells, in the gut wall, in the artery walls, everything has changed to a far less inflammatory, far less oxidative, far less hypoxic milieu into a tissue bed that is flowing with oxygenated blood, more nutrients, antioxidants, etc. It is such a profound change that is measurable and predictable, and I will show you the effects it has on various disease states. I could spend 3 lectures going through how a plant-based diet benefits every one of these organ systems. We don't have time for it, but there's getting to be a growing medical literature. It's hard to open up a medical journal without seeing some article on how a plant-based diet improves function in one or more of these organ systems. Well, but can you get enough protein on a plant-based diet? Absolutely. The beans, peas, chickpeas, lentils, grains, nuts, seeds, they're full of protein. And you eat 3 meals, you eat 2,000 calories based on these whole foods. You're guaranteed of getting 60, 70, 80 grams of high-grade, complete protein. Protein deficiency is not an issue if you're getting all your protein from whole plant foods. If you're a junk food vegan and you're just granola bars and energy drinks, yeah, you're gonna get yourself into trouble. But if they're whole plant foods, you're going to get enough protein, not an issue. So I want to take the next few minutes to talk about 2 specific diseases that are reversed with a whole food plant-based diet and talk to you about the mechanisms. That is the promise of this lecture, mechanisms of disease reversal. So let's talk about the biggest killer in Western societies today, clogged arteries leading to heart attacks, strokes, etc. And so this is disease reversal in cardiology. I wish most of our cardiology colleagues knew about this. We're working hard through our Moving Medicine Forward initiative to get that word out to this community. Because the reality is, every 40 seconds in the United States of America, that's 1,000 times a day, 380,000 times a year. Some American grabs their chest and falls over with a heart attack and dies because a inflamed plaque in the artery walls has torn open, and the exposed cholesterol sets off a clot in the artery, and the blood clot blocks the blood flow to the heart muscle downstream, and that heart muscle dies, going to an electrical arrhythmia, ventricular fibrillation that causes the death of the patient. Why did this happen? Well, bad genetics. He was just making too much LDL. That's his problem. And by the way, he wasn't taking statins. This is a sign of a statin deficiency. That's the whole problem, right? And many doctors, many primary care physicians, many cardiologists ascribe to this. Just pound down his LDL and he'll be fine. But half the people who die of heart attacks have, quote, normal cholesterol levels. It's got to be more than just a cholesterol level, and it certainly is. This is an inflammatory process. These arteries are inflamed. What is setting off the inflammation? Well, guess what? The red tide handiwork is evident here. These arteries are being repeatedly injured with every Western style meal. Here it is schematically. Here's a healthy artery wall. And here's that one cell thin lining, the endothelial lining that produces the nitric oxide, that's the buffer to keep our cells moving smoothly through the artery wall. But the patient's eating the red tide foods, the bacon and eggs for breakfast, cheeseburgers for lunch, chicken for dinner. And so every 4 hours, the red tide flows through the artery walls with oxidized animal muscle, the advanced glycation end products, the free radicals, and the vegetable oils that soak the French fries and the onion rings, the uric acid from the meat consumption, the high fructose corn syrup in the desserts, the phosphoric acid in the cola drinks. These are just some of the red tide molecules that, as they flow through the artery walls, they damage the endothelial lining, schematically shown here. And here is where oxidized cholesterol plays a role in the plaque formation. What are we talking about? Well, first of all, cholesterol itself is not an evil molecule. It's not a matter of just pounding down that bad old cholesterol because your liver is making it right now as we speak. Why is your liver making cholesterol? Because it's an essential molecule. Here's just some of the uses for cholesterol. Up on the top here's a native cholesterol molecule. The liver secretes it into the blood. As it flows through the adrenal glands grab that cholesterol. They do some chemistry on the side chains of the cholesterol molecule and turn the cholesterol into cortisol and corticosterone and aldosterone. These are essential hormones from the adrenal glands. Without them, you die. That's one thing the body does with cholesterol. If you are an owner of a pair of ovaries, the cholesterol created in the female body flows through her ovaries, and her ovaries do some chemistry on the side groups here and turn the cholesterol into estrogens, into estradiol, into estrone. These are essential estrogens. And if you're a guy with testicles, they will turn the cholesterol into testosterone. So cholesterol is not the enemy. It's a useful molecule. However, once you oxidize it, then you've got a problem. What is oxidation? Oxidation is the ripping of electrons off of a molecule or an atom. We all know what happens when iron gets oxidized. It rusts. It turns into iron oxide. We see that all over the automotive world there. Well, you can oxidize cholesterol too, and because cholesterol is only found in animal products, in meats and eggs and dairy products, it can be oxidized as well. And the very act of broiling the steak, just storing the cholesterol in the refrigerator, it oxidizes. And for you chemists here's the chemistry we're talking about. Here is the native cholesterol molecule. But when you grill the burger, broil the steak, you fry the chicken, you oxidize cholesterol, you rip the electrons off the cholesterol molecule, and you turn it into these cholesterol peroxides. And so when we talk about oxidized cholesterol, these are the problematic molecules. These are the oxidized cholesterol peroxides. And these are the guys that burrow into the artery walls, setting off plaque formation. Now, some cardiologists go off, well, the cholesterol in the diet doesn't get into the bloodstream. I beg to differ. It is clear oxidized cholesterol in diet is a source of oxidized cholesterol in the body. It accelerates atherosclerosis by increasing cholesterol levels in the circulating LDL. And it doesn't matter what animal tissue you broil, you grill, you're going to oxidize the cholesterol in it. Here you see schematically, this is an artery wall here. This is the inside of the artery. And here's the oxidized cholesterol molecules working their way into the artery wall. They are engulfed by these macrophage cells, and that turns the macrophage into what's called a foam cell, which is a teeming cauldron of oxidative free radical damage to the tissues around it. And this sets off inflammation, which leads to the atherosclerotic plaque formation. So here you see the oxidized cholesterol molecules working their way through the damaged endothelium into the artery wall. They're engulfed by the macrophages, sets off inflammation, and that's what leads to the plaque formation. Now, is this a relentlessly progressive disease? Most cardiologists say, yep, once they get that angina, once these plaques show up, it is relentlessly progressive. They're all going to need certainly statins, but they're all going to need stents. They're all going to need bypasses. Yes, doctor, if you don't talk to them about changing their diet, that is what you're going to see. It becomes a self-fulfilling prophecy, but it doesn't have to be that way. Actually, the truth is this disease is reversible. These plaques can be melted away with a whole food plant-based diet and a health promoting lifestyle. Those who are familiar with the work of Dr. Caldwell Esselstyn knows how he demonstrated this in his wonderful book, Prevent and Reverse Heart Disease. I highly recommend this for anyone with clogged arteries or a family history of atherosclerosis. And from his work, he published some landmark studies. And here's one of his most powerful that should make every cardiologist stop and reconsider the entire nature of their medical practice. Dr. Esselstyn was sent almost 200 patients with, you have to say, end-stage clogged arteries. Every one of these, almost 200 men, had clinical signs of clogged arteries. All of them had a stent placed for their angina. They had a myocardial infarction. They had a heart attack. They had a stroke. They had pain in their legs from clogged arteries as they walked. Every one of them was a vascular wreck. He would send the end-stage patients too clogged up to even bypass. There was nothing more to stent. Send them to us, the cardiologist said. And so Dr. Esselstyn wound up with 200 of these patients. So what did he do with them? He put them on a diet of whole plant foods, specifically, rigidly, a whole food plant-based diet. And he followed these almost 200 men for 4 years. Well, you take 198, almost 200 men with clogged arteries eating the standard Western diet, and you follow them for 4 years. Statistically, 60 of these men are going to experience a major adverse cardiac event. They're going to have a heart attack, a stroke, sudden death. Something major bad is going to happen to these folks, and to 60 of them if they continue eating the whole food plant-based diet. So how many of Dr. Esselstyn's almost 200 patients assiduously following a whole food plant-based diet, how many of them had a major adverse cardiac event? Essentially, none of them. They were all essentially completely protected from heart attack, strokes, claudication, angina. And in fact, those folks with angina who got chest pain as they walked because their heart arteries couldn't deliver more blood flow to their heart muscle, 9 out of 10 of them, their angina improved or went away altogether. This is so profound. There was a pill that did that. Dr. Esselstyn would be a trillionaire by now. And of his patients who would not follow his whole food plant-based diet plan and reverted to their standard Western diet, of them, over half of them experienced a major adverse cardiac event. They had a heart attack, a stroke, and sudden death, etc. This is so profound, and he has replicated these findings again and again. It should make every cardiologist, when they read this study, pick up the phone, tell their receptionist, cancel my afternoon patients, and get Dr. Esselstyn on the phone. I got to learn about this program because this is truly healing my patients. So how does it work? What is the mechanism? Here is the goods on Dr. Esselstyn's plaque reversing diet. First of all, and the heart of it, so to speak, pun intended, is, guess what? A diet based on whole foods. And the key to this is the most important thing is what isn't on this slide. The red tide stops. The molecular assault full of free radicals, oxidized cholesterol with every meal stops. The AGE stop. And in their place comes all these wonderful soups and salads and steamed veggies filled with the antioxidants and the molecules that promote tissue repair, quench free radicals, etc. So that is by far the red tide stops, and the healing plant-based foods flood the tissues with these beneficial molecules with every meal. So that's the real key to this. But also, Dr. Esselstyn insists that the patients with really severe clogged arteries, at least 3 times a day, have a fist-size helping of some dark green leafy vegetable, kale, broccoli, cabbage, Swiss chard, etc. Why does he do that? And he wants people to put a little bit of balsamic vinegar on the greens. Why does he recommend greens in the diet? Because this is the mechanism of reversal. Here we are back at the artery wall here on the bottom. And here are the oxidized cholesterol molecules that came into the artery wall, they stop. The red tide onslaught ceases. And the molecules that now flow through the tissues promote resolution of the inflammation in the artery walls. So the most important thing, again, the red tide stops, and all the nutrients are coming from the whole plant foods. And here are the dark green vegetables that are eaten 3 times a day. So the intestinal tract essentially always has a bolus of these dark leafy greens that are constantly being digested, and their antioxidant nutrients are constantly getting absorbed. It's like a time-release capsule for antioxidants molecules in your gut that are constantly leaching into the bloodstream. So the bloodstream is steadily 24/7 filled with these antioxidant molecules. And as the days go by and the weeks go by and the months go by, these antioxidant molecules from the greens, which are now always in the bloodstream, start seeping their way into the artery walls. And if they find any free radicals boiling away down in the foam cells, that oozes in, the antioxidants ooze in there, and they neutralize the free radicals. ROS, reactive oxygen species, these are the free radicals. And they get neutralized. And with no more free radicals around, these foam cells, they leave, they outmigrate. You can see it on the electron microscope. And as the macrophages outmigrate, the plaques get smaller and smaller and smaller, and the artery begins to open up. The blood flow channel increases, resolving the angina. And the endothelial lining that has been damaged and thinned now starts repairing itself, not by magic, but because the bone marrow is constantly putting out showers of stem cells that reupholster the artery walls like new paving stone. And as a result, you get spectacular improvements like this. Many of you have seen this classic angiogram of a man, 46-year-old man with severe angina. He already had 1 heart attack. These are the arteries in his heart. They're filled with angiography dye, and the entire blood flow channel should be about this wide all the way down. But this narrowed, rat-eaten portion here, these are atherosclerotic plaques that are encroaching into the blood flow channel. This man has such severe angina, he had to stop every 20 paces or so to let the angina subside, or to take a nitroglycerin tablet. You did not want a stent, didn't want to go on statins. As Dr. Esselstyn said, fine, go on my whole food plant-based plaque reversing diet. And the man followed it to the letter. And meal after meal, soup, salad, steamed veggies for 29 months, flowing through the artery plaques melted away, and this artery turns into this artery. Same patient, same artery, But look how reversible this disease is. And as obviously his angina was gone, and he was able to take nice long walks, and the threat of sudden death from a heart attack or stroke was essentially removed from this man due to the whole food plant-based diet and a healthy lifestyle. Why does Dr. Esselstyn urge us to put a little balsamic vinegar on the greens? Because that increases the production of nitric oxide in the artery walls, that heals the artery walls and increase that subtle vasodilation. So Poiseuille's law can kick in and increase blood flow throughout the body. Poiseuille's law is so important here. Just a little melting away of the plaque and a little relaxation of the artery wall that creates a little bit of vasodilation gets that really significant blood flow increase through the body. Here you see the effect. Here's a man. This is a cardiac perfusion scan showing blood flow to the heart muscle. Red is good blood flow. You can see how choked down this man's heart arteries are, how little blood flow is getting to his heart muscle. The man went on a whole food plant-based diet for just 2 weeks. The plaques might melt away a little bit, but again, due to all the antioxidants and the lack of the arachidonic acid and all that, the artery walls begin to dilate just a little bit. But Poiseuille's law kicks in for that little vasodilation, and as a result, cardiac perfusion scan like this turns into a perfusion scan like this. You can see how much more blood flow is going to the heart muscle after just 14 days. So it's not an exaggeration to say your angina gets better quickly. What a miraculous thing that is. And yet most cardiologists never mention this to their patients. I first saw this study in 1977. Dr. Frey Ellison in the UK reported a 65-year-old man with such severe angina, he had to stop every 9 or 10 paces, went on a whole food plant-based diet, and 6 months later, he's climbing mountains in the Lake District of the UK with no angina pain. How profound, what a life-changing, life-saving program this is. And it's ours for the simple expedient of choosing the bean chili instead of the beef chili. This is free to everybody if we're just adopting a whole food plant-based diet. And not just heart arteries open up, the arteries all over the body open up, much to the delight of people at home. I'm sure this woman is really thrilled that the retinal arteries in his eyes are now more open, as are the renal arteries to his kidneys, as well as other arteries to other organs in the body. Blood flow is life. And as all the arteries in the body open up, the vital forces are restored to tissues all over the body. There's now getting to be a growing literature substantiating the reversibility of atherosclerotic clogging of the arteries. I'm going to show you a number of slides listing these studies. And because this talk is being recorded, I'm going to invite you to go back, replay it, and stop the video at these kinds of slides to see the actual studies and look them up if you want to learn more about this revolution in medicine, disease reversal through plant-based nutrition. So angina, claudication, which is clogged arteries in the arms and legs, certainly get better. But so does high blood pressure, congestive heart failures. People get leaner and their heart muscle perfusion gets better. Heart failure can get better. Kidney failure gets better, especially as relief from those high protein diets takes effect. And it forces the doctor to learn a skill that no one mentioned to me in medical school, called deprescribing. There's an art to getting people off these potent medications, statins and high blood pressure pills, but it's easy to learn, and doctors need to become skilled in deprescribing these cardiac and blood vessel medications, all medications actually. I invite my patients to go to my website, drklaper.com, click on Answers, and download my health supporting eating plan, where I take folks through a day of healthy eating and a diet plan they can base their entire food intake around. I'll invite you viewers of this presentation to download this 5-page handout. It's full of recommendations for videos and articles and aids to help in this transition. So, disease reversal in artery disease is certainly possible. Same in type 2 diabetes, which is the most common source of most common variety of diabetes. We're not talking about type 1, where the pancreas is not putting out insulin any longer, but type 2 diabetes, where the pancreas is putting out lots of insulin, but the insulin isn't working well. Why is that happening? The mechanism behind type 2 diabetes was demonstrated way back in 1927 by Dr. Sweeney at Yale. Now, when you ask most people, what's the problem with diabetes and how do you control it? Oh, the word that comes out, sugar, sugar, it's from eating too much sugar, and you got to eat a low sugar diet. Those carbs are bad. Ooh, avoid those carbs because they give you diabetes. Well, Dr. Sweeney demonstrated something very different. What did he say? What did he do? He took his medical student, he taught at Yale, and he divided the medical students, they were all young men at that time, and divided them up into two groups. One group he put on a high carbohydrate diet for 48 hours, for 2 solid days. These young men ate nothing but sugar, candy, pastry, white bread, baked potatoes, syrup, bananas, rice, and oatmeal. This was a high carb diet for 2 solid days. Well, that should be enough to give anyone a diabetic curve. Well, after 48 hours, 2 days of eating this high carb diet, he gave each of them a drink with 100 grams of sugar or glucose in it, and 2 hours later checked their blood sugar to see what their body did with it. Well, lo and behold, every one of these young men who had been eating for 2 days a atrociously high carbohydrate diet, every one of them, after 2 hours, their blood sugar was back down well below 120. There was in the 115 or lower range. They were basically non-diabetic. Over half of them, their blood sugar was in the 100 milligrams percent range or lower. Certainly, no diabetes was caused by the high sugar diet. But the other half of his medical students, he put them on a high fat diet. For 2 days, they ate nothing but olive oil, butter, mayonnaise with egg yolk, and 20% cream for 2 days. He then gave these young men the same 100-gram glucose drink. 2 hours later, drew their blood sugar, and every one of these young men had blood sugars well in the diabetic range. That's above 115, 120. That puts you in diabetic range. Every one of these young men on a high-fat diet were in that diabetic range. Their insulin receptors were so clogged up with fat. Now, of course, when they went back to their standard diet, depending on what they ate, this was not permanent. Their insulin function reverted to as normal as it could, depending on how much fat these young folks were eating. But it wasn't the sugar, it was the fat in their diet that clogged their insulin receptors. Here it is schematically. Here is a muscle cell. It burns glucose. You eat an apple and the sugar shows up in the blood. This prompts the pancreas to put out insulin, which engages the insulin receptors that sends a message through enzymes to the surface of the cells, saying, hey, let that sugar into the mitochondria so we can burn it. That's what's supposed to happen. But if the person's been keeping their blood fatty week after week, month after month, all that fat has permeated into their muscle cells, their liver cells. It accumulates as intramyocellular lipid, that means in the muscle cell lipid, and it clogs up the enzymes making the insulin receptors work. Now, we're going to talk more about this mechanism, but I just want to say this is not theoretical, this intramyocellular lipid. This is not a theory. Here's what it looks like under the light microscope. This is muscle. This is striated muscle from an arm or leg. And all this black stuff, this is fat in the muscle cell. This is intramyocellular lipid that should not be there. This is under the light microscope. Here's what it looks like under the electron microscope. This is fat in the muscle cell that's poisoning the enzymes that make insulin work. And this is not theoretical, it's a real thing. So here you see the insulin receptors, their enzymes are all clogged up from the fat in their diet that they've been eating on a regular basis. And if the person, and there's getting to be a growing literature about intramyocellular lipid causing insulin resistance. But if the person happens to have an obese abdomen, that adds another layer of insulin resistance. How? Because that fat in the abdomen wrapped around their intestines is metabolically active. And this fat pumps out what are called inflammatory cytokines, interleukin 1, interleukin 6, and these promote inflammation throughout the body. It's called metabolic inflammation, these inflammatory cytokines. And there's going to be a growing literature here about obesity-related inflammation. People make this passionate plea, well, you shouldn't be fat shaming, you can be healthy if you, even though you're obese. The vast majority of folks with obese abdomens are walking around with high levels of inflammatory cytokines. It's called metabolic inflammation. With most folks, obesity is a state of inflammation. And when you say you can be healthy with an obese body, I'm far from convinced of that. I think obesity is a state of inflammation, and the literature certainly supports that. So here we are back in the muscle cell. The fats in the diet have worked their way into the cell as intramyocellular lipid. They're tying up the enzymes on the inside of the cell that make insulin work. But here comes those inflammatory cytokines from the obese abdomen interfering with the insulin receptors from the outside. No wonder so many obese people develop type 2 diabetes. Their insulin receptors are clogged up and interfered with both from the inside and the outside. And that explains Dr. Sweeney's medical students and why the folks on the high carbohydrate diet did not develop a diabetic curve when the folks on the high fat diet did. And it happens rapidly within 48 hours. A high fat diet, you can see the effects all that fat has. Well, fortunately, this talk is about disease reversal. This is a reversible disease as well. If one stays away, and this is symbolic, doesn't say that the hamburger is the only problem here. It's all the excessive fats in the diet, and it doesn't mean the only thing you can eat is broccoli and tomatoes. This is symbolic for a diet based on whole plant foods. When one changes from the standard Western diet to a whole food plant-based diet, the diabetes begins to go away. And here's Dr. Barnard's classic studies where they compared a low-fat plant-based diet to the standard diabetes diet. After the heavy animal fats are pulled out, the fats that are already in the muscle cell, the intramyocellular lipid, gets oxidized, gets burned by the mitochondria for fuel. And so that frees up the enzymes inside the insulin receptors, and the inflammatory cytokines fade away, and so the insulin receptors open up, and the diabetes resolves. And they were working fine all the time before. They will work again. It's a reversible disease. And here's the results from Dr. Barnard's study. And the folks on the plant-based diet compared to the Diabetes Association diet that allows some meat and dairy. The folks on the plant-based diet experience a greater improvement in their hemoglobin A1C. They lost more body weight. Their lipids improved more. They spilled less protein in their urine. All the way around, their body started healing beautifully on a diet of whole plant foods. And all of us who practice plant-based lifestyle medicine have patients like Jim. He used to be 100 pounds overweight. Again, here's that classic overweight person with type 2 diabetes. They're clogging up their insulin receptors from the inside, the outside. He went whole food, plant-based, lost the weight, and a year and a half later, he's 100 pounds lighter and running marathons. And guess what else he lost? He lost his diabetes as well as all that excess body fat. It's a reversible disease. People need to know that. And again, forces the doctor to learn the skill of deprescribing insulin and these hypoglycemic agents as well. There's getting to be a growing literature. If you're interested in this specifically, come back to this slide and check out each of these studies showing the reversibility of type 2 diabetes on a whole food plant-based diet. And in this age of Ozempic, and people are spending $1,000 a month for a medication that can help them lose some weight, not in everyone, and it carries many side effects as well. When they're trying to force their body to do what happens naturally, automatically on a diet of whole plant foods. As I mentioned earlier, a whole food plant-based diet, the food that's going down into your stomach is mostly fiber and water. That's what fruits and vegetables are made of. And the fiber and water don't stick to you, they're excreted. So even though you're eating plenty of food, excuse me, the calorie density is so low, but the weight comes off by itself. You don't have to diet. You don't have to carb count and calorie count at all. And so the findings that are displayed by these men are the natural results of a diet based on whole plant foods, and doesn't cost $1,000 a month to inject a drug to create this effect. And again, there's going to be a growing literature on the effects of whole food plant-based diet on obesity. As I mentioned, it's inflammatory. It's an anti-inflammatory diet. You're pulling out the pro-inflammatory arachidonic acid. You're healing the leaky gut. And as a result, inflammatory conditions throughout the body get better, including rheumatoid arthritis. But autoimmune diseases in general, lupus, ankylosing spondylitis, often get dramatically better. And if you or a loved one or a patient has lupus or an autoimmune disease, please get this wonderful book by Dr. Brooke Goldner, a physician who put her own lupus into remission, but with a whole food plant-based diet. She has a wonderful program on how to do it. It's called Goodbye Autoimmune Disease, required reading for anyone who has or cares for people with autoimmune diseases. The folks suffering the curses of colitis and Crohn's disease can start reversing that condition. The gut will heal, but not if you're damaging it 3 times a day with the cooked animal muscle and the fryer oil from the French fries and the dairy protein, etc. A whole food plant-based diet is step one to reversing these inflammatory diseases. There's studies showing that getting the meat consumption down to just once or twice a month is enough to really help put Crohn's disease into long-term remission. The asthmatic folks, again, the anti-inflammatory effects of the diet benefits the bronchial tube muscles. The change in the mucus from the higher water content diet makes it easier to breathe. And so the asthmatic folks gain much relief from adopting a whole food plant-based diet. The folks with the inflamed skin, with the eczema and psoriasis, often see those changes, those conditions radically improving right before their eyes. And yet most doctors know nothing about this. No one mentions it to us in medical school. And it's a tragedy. People are dying on real operating tables from diseases they don't need to have that surgery for, because they could melt these diseases away from the inside with a diet based on whole plant foods. So the concept of disease reversal, especially through a whole food plant-based diet, is so powerful and so key. It should be the goal of every physician as well as every patient. And the physician should talk to their patient. What a hopeful message. How can we'd like to reverse your high blood pressure. We'd like to reverse your type 2 diabetes, like to unclog your arteries. Let's get you on a program that will do that. And so what I'm proposing to the doctors as well as as to the designers of our medical care system is a fundamental change in the way that medical care is delivered. As I mentioned earlier, in one of the first slides, the primary care doc sees the patients, makes a diagnosis, and gets them medication or to a surgeon. What I'm advocating is, first of all, the doctor needs to be a doctor, practice standard medicine, take a good medical history, do a physical exam, order your lab tests. But then the next stop should be, I want you to see Mr. Wilson or Ms. Smith down in room 421. They're the plant-based dietitians. They're going to talk to you about what to eat. They're going to give you handouts. They're going to show you videos. They're going to take you shopping. You eat like they say. And if necessary, they'll assign you a health coach that you can call if you're tempted, who will check in on you once a week. And you come back and see me and the dietitians every month. Let's see if you're not leaner and healthier. This is how medicine should be practiced in the 21st century. This works well through telemedicine. And the nurses that are leaving hospital care can be very valuable adjuncts to your treatment team. And I'm advocating to bring the dietitian onto the primary care team until today. The dietitian is held at arm's length. She's an afterthought. I'm saying bring her onto the primary care team. And I have recently joined the staff at Aroga Lifestyle Medicine Clinic in Victoria, BC, because the Canadian government is really serious about reversing disease, and they pay for the dietitians. The problem with American medicine is they don't pay for the dietitian. Who's going to pay for the dietitian? Well, the Canadian government does. And so at Aroga, the standard patient flow is the patient's referred in by the general practitioner. They have the appointment with the physician, and the next stop is a plant-based dietitian. And only then, after they get on a plant-based diet, are they referred on to physiotherapy, cooking classes, yoga, specialist care, and they are followed up with the dietitian and the doctor on a regular basis. This is how medicine should be practiced in the 21st century. I have joined the staff as director of telemedicine services. I am going to be gathering data of the success of this approach and then bring it back to the United States and give a lecture to the medical societies and the medical meetings saying, here's what can happen if you get plant-based dietetics incorporated into your primary care model. This is how you actually reverse diseases. I am excited about these next year's practice as part of the Aroga Lifestyle Medicine staff. And again, where do you get a plant-based dietitian? Just seek and you shall find. There's going to be more and more plant-based nutritionists and dietitians available. So I tell the young doctors that a whole food plant-based diet is the most powerful tool they will ever wield. Here's my patient, Ken. Ken came in 25 pounds overweight on 3 medications for blood pressure and diabetes. Within 12 weeks on a plant-based diet, he lost almost 25 pounds and got off his medications. People can change. They do change. So it's up to each of us, lay people as well as doctors, educate yourself. Go to plantnutritionuniversity.org. And there's an abundance of courses on the entire lifestyle phases on how you can create a healthy body on a plant-based diet, free for the taking. Go to the University of Winchester website. You can take their 6-week online course in plant-based nutrition. I took it and learned a ton. There's wonderful books now, Plant-Based Nutrition Clinical Practice by Dr. Kassam. Here's Dr. Stancic's wonderful book, highly recommended on what's missing from medicine. She talks about disease reversal through plant-based nutrition. There's even a medical journal on disease reversal. It's a thing that we need to start introducing to our doctors and patients. The American College of Lifestyle Medicine has an abundance of courses, free for the taking, on whole food plant-based nutrition. So we're essentially at the end of the talk. I know it's been a long one, but once you look behind the curtain, you can't pretend you don't know what's behind the curtain. And I'm trying to tear that curtain down of etiology unknown nonsense. It's the food, it's the food. And at this point in the lecture to the medical students and the residents and the attending physicians, I ask a provocative question. I say, knowing how reversible the diseases that you were going to spend the majority of your professional lives treating, knowing how reversible these diseases are with a whole food plant-based diet and healthy lifestyle practices, you want to heal these patients, you want to get to the root of their problem, or you just want to manage their chronic disease. If you're just going to manage their chronic disease, you're going to leave medicine. It's a dismal way to practice medicine. You want to really heal these patients, then get real about why they're sitting in front of you, overweight, diabetic, hypertensive, clogged up, and inflamed from what they are eating every 4 hours. So here is that report from the front lines as I as the advanced scout that's sending the message back to the reinforcements, the young doctors that are coming into the fray. What's my report to them about the cause of these diseases? It's the food. It's been the food all along. We've been looking for genes and viruses. It's the food. And guess what? A whole food plant-based diet is the key to reversing these diseases. Because if you don't do this, the doctor condemns themselves into the fate of the blind men and the elephant, where they each have a hold of a different elephant. Well, it's true for them, a different part of the elephant. It's true for the medical specialists, the cardiologists in their cubicle treating the clogged arteries, the endocrinologists in their cubicle treating the type 2 diabetes, the gastroenterologists in their cubicle treating the Crohn's disease and the colitis. Little do they know, and it's the great tragedy of Western medicine, they're all treating the same disease. They're a different manifestation of the pathogenic diet their patients are eating. And the tragedy is that if you get these patients on a whole food plant-based diet, the doctor and the patient will see these diseases remarkably improve and usually resolve altogether because it was the food all along. So the last slide says that a new era in healing is open to all of us. The plant-based wave is breaking. Line up your surfboard and start your own era of health and healing with your very next whole food plant-based diet. These are the resources that you should take advantage of. And these are the major mechanisms of disease reversal utilizing plant-based nutrition. What changes when you go from an animal-based diet to a plant-based diet? Everything changes, and we should take advantage of that. Okay, so with that, I will stop my share, and we have a few minutes left over for questions. A
Yeah,
lot of information, but hopefully it's been
yeah,
useful.
tremendous amount of information. Thank you for sharing all of that with us. Always a pleasure to watch you present all this information in a very digestible way. So real quickly, so you showed on your last slide how people can get in touch with you, drklaper.com. And then your books are available on through the bookstore. Any purchases will be through Amazon, but The Real Truth About Health will get a little bit to help us fund the great work that we're doing here. So we're going to begin the Q&A. I'm going to try to get to audience also, but we just have a very few minute, very limited amount of time. Real quickly, given the current paradigm for medicine and how people make their money, how specifically doctors, how like what financial incentive, and not even a financial incentive, like they're gonna, but how could they sustain their lifestyles, to be quite honest, right? Right now doctors are extremely well paid. There are many doctors making over $500,000 a year, and they're making it in through dealing with insurance companies that fund certain things and not others. How is it possible that a doctor who wants to do this stuff but has built himself a lifestyle based on doing procedures and prescribing medications can move over to this without harming themselves financially?
Oh my. And that is the $64 question, $64 million question. And it's the nut of the problem we're facing here. It's not going to be easy. It could be easy. Again, if the insurance companies were really interested in helping their patients heal instead of making money off every bypass and every stent and every prescription written, they would see that they would hold on to more of their money by truly getting their patients healthier. And because there's money to be made in keeping people healthy. For every CEO of a company that doesn't go down with a heart attack or a stroke, their employees continue earning paychecks, paying taxes to the community. There's benefits to keeping people healthy, but that needs to be incorporated into the insurance reimbursement. We're at a time of transformation. What happened to the whale harpooners when whaling was outlawed? What happened to the buggy whip makers when automobiles came in? They wound up doing something else. They had to change. They saw that era has passed. Now you're asking how can a practicing cardiologist go plant-based here and still make money? There's probably going to be a dip of an income, but they're going to get more patients. And most of the money is made from that initial assessment and the test ordering, et cetera. And this happened to uh, head of cardiology at Presbyterian. They got their patients on a whole food plant-based diet. They started seeing fewer patients because their patients were getting healthier, but that opened up spaces in their schedule to allow more patients to come in. And they actually made most of their money on the initial assessment and prescriptions and treatments that were prescribed. So it can be done. The insurance companies need to change their reimbursement models and reward the doctor and the patients with lower rates for keeping themselves healthy. It could be done, but it's going to take lots of work. And that's why I want to gather the statistics up in Canada and bring them to the US and give those lectures saying this is doable and everybody wins. The doctor and the patient will win with this evolution. It's not going to be easy, or a couple of oxes are going to get gored here for a non-vegan analogy, but we have to do that. The present model is leading us to death and bankruptcy. We've got to change it, and it can be done. So that's what we're trying to do.
So last year we spoke about Dr. Furman's assessment that he's seeing many vegans come in with dementia, long-term vegans. So one of the things that he thinks that people should be on is DHA EPA. And I know that you had mentioned that for a long time you were reluctant on it, but he eventually convinced you to take that. How have you found, well, what are your thoughts on what he is seeing in his patient population, and how have you found supplementing DHA and EPA, realizing that's just an N of one, but how have you found that? Has that been, meaningful to you? Have you noticed a difference? Is it worth people who are listening, is it worth them taking such a supplement?
Oh boy, this is not going to be a very satisfying answer. I am far from settled on this question. I have my experience has been different than Dr. Furman's. I've not seen lots of vegans, any vegans with dementia. I'm not saying they can't happen, but it depends on what these people ate in their diet before they became vegan. If they ate the standard Western diet till they were 70 and changed to a vegan diet, then the damage has already been done. It's very hard to extrapolate from a handful of patients. My omega-3 index is very low, so I reluctantly started on it, but I am highly dubious that one, it's having any effect at all. And there's going to be more literature showing up that the body makes all the DHA it needs. If you give it the omega-3 linolenic acid in the walnuts and the flax seeds and the hemp seeds, et cetera, the body will make all the DHA that you really need. So I am still on the fence here, and I'm leaning more towards stop taking this stuff. But I'm going to be following the literature about this very issue here. But I'm getting to be more and more skeptical that it really makes much of a difference at all. I take it a few times a week, a bit of a Hail Mary. But again, I need to be convinced. Now, there are some semi-convincing studies, as Dr. Furman, Dr. Kahn will point out about this dementia issue. So I'm reluctantly taking it, but I'm with a moderate amount of skepticism at this point. So stay tuned. When I get to a definitive decision, I'll make another video. But right now, I'm still taking the stuff, but I'm skeptical.
Okay, well, I appreciate your honesty on that. So on the same topic of supplementation, what are your thoughts on things that people should consider, based on the studies that you've seen, such as obviously B12, I think is pretty well settled. I mean, T. Colin Campbell is not a big fan of B12, but I think his wife forces him to take it, as if I recall our conversation correctly. But but D is extremely popular. Are there any, what are your thoughts on supplementation on a whole food plant-based diet? And is there anything that where the science is just really conclusive? And is there anything that you want to hedge your bets on and you would suggest people take, even though the science is not as clear?
B12 and D, but even Dr. McDougall says vitamin D actually creates adverse effects. Everyone is hesitant to be taking these supplements, and rightly so. No other animal, no gorilla takes vitamin D supplements. They're living natural lives. But I do take the B12 and the D. The only other ones of concern is iodine, which we need for our thyroid gland. If we're not eating fish, so if you're not eating sea vegetables on a regular basis, I would say, which you should. A few times a week, we throw a gob of arame or wakame into a soup or salad. I use very little salt, but a pinch of iodized salt probably makes some sense. But in the multivitamin I take, there is 150 micrograms of iodine. So cover your iodine needs. That should do it, but in most of these multivitamins, there's a little bit of zinc, and that's probably a good thing for most vegans. Zinc can be a little problematic unless you're eating a really substantial amount of legumes, which you should be every day. So the zinc and the iodine are the other two that if you're going to be taking a vegan multivitamin, then make sure they've got a significant amount of iodine and zinc. Those are about the only two that I would add to that list.
All right, I'm going to throw a question out to the audience. So, Kevin, if you can unmute yourself, state where you're from, and ask your question.
I'm sorry, go ahead.
Yeah, hi, Dr. Klaper. Can you hear me?
Yes.
Very well.
Okay, cool. So, is there any adjustment on your dietary recommendations for recovering alcoholics or people with both alcoholic and non-alcoholic fatty liver disease?
Well, the whole food plant-based diet is the definitive treatment for fatty liver disease. One, obviously, the ethyl alcohol should never pass through the liver again. And the liver is the champion organ in the body for healing itself, but you got to give it a break. So zero alcohol ever again. And because of the venous system, the system of veins in the body that are wrapped around the intestine, they all come together to form the portal vein that goes right up into the liver. So everything you eat goes right up into the liver and bathes the liver cells with all the whatever was in the meal. And the beauty of the salads and the soups and the steamed veggies, they're full of these phytonutrients that flow through the liver and heal them. And so we can talk about some supplements, but the most important way to heal a liver is yank out the alcohol and the junk sugars that turn into uric acid, et cetera, the high fructose corn syrups, all that stuff. Stop that. And the whole food plant-based diet and tincture of thyme will allow that liver to heal. I've seen stunningly damaged livers repair themselves with a whole food plant-based diet.
Thank you. So we're sugar is extremely vilified as being like the worst thing, and then also by the transitive property carbohydrates. What actually puts fat on our body? Is it sugar or is it fat?
It's the combination of both. There's something called oxidative priority. When you eat fat and sugar at the same time, because it's easier to burn the sugar, the body thinks, fat, sugar in the blood. Let me burn that sugar now. I'll store that fat for later. So when you pour oil on your pasta, you're creating that fat-sugar combination. Most baked goods are fat and sugar. The flour is the sugar, and there's some fat, some shortening egg yolks holding that sugar together. So it's the fat sugar combination that sticks to folks. It's the baked goods, it's the flour products, and the added oils and fats that cause the problem. Your body can handle small amounts of natural sugars in the whole foods. They can handle small amounts of the whole fats that are in the walnuts and flax seeds, et cetera. But get your fats out of whole foods, not out of glass bottles. That's why we're not big fans of oils here. So it's not a matter of what's bad, fat or sugar. We need them both, but they should come from whole plant foods. If you're eating whole plant foods, obesity really isn't an issue for those kind of folks.
And what are your thoughts on, so for people, most people are not on a whole food plant-based diet, right? That's the reality of the situation. When they get high blood pressure or they get cholesterol, they're thrown medications. Do those medications actually address their likelihood of dying from these ailments and their health conditions as a whole? Or are they just masking a benchmark, or a symptom of a larger metabolic issue?
The answer is in your question, of course, and most cardiologists, they don't talk about it, but the fact is, despite these huge amounts of statins, the amount of actual cardiac death has decreased by that much. For pounding down that cholesterol, we have not seen a dramatic reduction because that isn't really the problem. The issue isn't how high is your cholesterol. The question is how healthy are your artery walls? How have you been treating them? Are they inflamed and developing plaque, or aren't they? If you're eating rice and beans and greens and fruits and vegetables, there's no reason that you should be developing plaque on the inside of your arteries. And just using these drugs to pound down your liver's ability to make cholesterol or to crank those arteries open can have some benefit, but they are not getting to the root of the problem. It's the food. It's been the food all along. And that's where we really have to put our focus.
And if someone's eating a whole food plant-based diet and they're doing everything right according to your protocol, and they still have cholesterol at, say, 200, is that something they should worry about and take medication for, or is it just, all the other indications seem okay, but the cholesterol is just at 200? Is that just the way it is?
It might be just the way it is. I tell people if they go to my video Beyond Cholesterol on my website, well, we talk about this very issue there. And again, I tell people if you're not eating anybody else's cholesterol, trust your liver. It knows how much cholesterol to keep in your bloodstream. But get your inflammatory markers checked. And I list them there, the HSCRP and myeloperoxidase, et cetera, and get a scan of your carotid arteries. If your inflammatory markers are negative and your carotid arteries are healthy and no plaque, you don't have the disease, even though your cholesterol may be 200. So again, it's how every meal is treating your artery walls there. So now I've got a couple of vegans with clogged arteries, but they've been eating flour products and vegan junk foods, and those will hurt you. But if the diet is basically just whole foods from the garden, there's no reason you should be developing plaque in your arteries. So it's a rare thing to happen. So again, the question is not how high is your cholesterol, it's how healthy your arteries. Be nice to your arteries. They'll be nice to you.
Perfect. And unfortunately, we've run out of time. So I want to thank you for all the information that you shared today. If we can unmute the audience so they can share their appreciation.
Thank you. Thank you. Enjoy your life.
Thank you, Doctor.